We've seen time and time again how healthcare organizations, when you look at clinical settings, is difficult because you're optimized for a fee-for-service model. Patients come in, they go out. Really works really well when that model was the dominant model. But now with the advent of technology, like we talked about, and the ability to deliver services remotely, now you have to create new models that make sense. For instance, we've seen cases where if you're delivering these services in-house, you're looking at least profitability loss of about 20 to 35%. How does that calculate it? Well, when you look at this new delivery model for healthcare will change how patients receive care. The future of healthcare is now, and patients want services at home. Here's how you can deliver that at scale. This delivery model will take over healthcare. For those that don't know, my name is Theo Harvey. I'm a healthcare consultant and entrepreneur. And one of the things that we're seeing tremendously is what healthcare organizations are looking at as they look to grow for the future. One of the key things that's happening is patient care being delivered at home or remotely is becoming table stakes now. After the pandemic, we've seen tremendous interest in patients receiving care at home for things like wellness visits, outreach for care of chronic conditions, helping select new doctors and support for that, caregiver support. There are tons of different opportunities where we're seeing healthcare organizations look for ways that they can deliver it at scale, because let's be honest, the healthcare system was not meant to deliver care remotely. So let's talk a little bit about why this is important. There are numbers that are showing that by 2029, we should see the outsourced market grow to about $233 billion. That's an increase from 131 in 2024. That's right. Outsourced healthcare services is going to be more and more important as healthcare organizations are constrained by their current budgets to grow where they see possible. That's why we're talking about a new delivery model. This delivery model is called Remote Care as a Service, or RCaaS. It's a new term, but it's something that's been around for ages. Telehealth is a component of that piece, right? But Remote Care as a Service is definitely more comprehensive. It's a more delivery model that combines technology, processes, and financial acumen in order to deliver care at scale for patients that want it at home. So how do you kind of break it down when you think about those different areas in delivering healthcare to the patients that want it most? One of the ways we think about it is, number one, you have to think about the technology. The advent of telehealth spearheaded this, but that was only because of the ubiquity of smartphones and technology that can deliver person-to-person communication anywhere in the world. I remember talking to clients about how we're not just constrained to a geographic area anymore. We know what's happening anywhere across the world. And this is important when it comes to remote care. Having these cellular devices communicate wherever a patient lives is important, not just from a communication, but also to grab vital patient physiological conditions, such as blood pressure, weight, glucose readings. All these type of physiological readings can give insight into how the patient is helping. More importantly, we're seeing the advent of delivery of drugs and other type of services to patients at home. Tests are now being delivered at home. So patients can do a lot of the things that they used to have to go to the hospital or to the doctor to do. It can be delivered at home. And we're gonna see more and more of that. Technology enabled by cellular enabled technology devices like blood pressure cuffs that have cellular chips in them that can deliver information wherever the patient is at. We've had cases where patients have traveled across the country and still were able to take their blood pressure readings where the doctor can see them remotely. So having cellular technology is important and devices, but then how do you deliver that at scale? If your organization, having the technology is one thing, but being able to deliver it across the organization is going to be huge and very important. Technology can help with that as well. With the advent of artificial intelligence, the ability to do two things, right? One of the things that we see artificial intelligence help in is to be able to communicate to patients cultural relevant information. For instance, artificial intelligence is really good at scale. So that means it can personalize specific conversations to patients that need it most. We've seen cases where we'll be able to translate text messaging or even change messaging to make sure it fits a certain literacy level Typically, we try to reach out to patients at the 5th grade level in any language so that a patient can understand exactly what they need to do at home remotely. Artificial intelligence is important for that. Artificial intelligence also helping to make our internal teams who deliver care remotely more efficient. The ability to have nurse teams that can operate in a command center type format where they know what patients to reach out to that's better triage is really important and instrumental in ensuring that patients get the care that they need at home. Artificial intelligence is already here and more healthcare organizations are utilizing it more than ever before. Obviously, there are big conversations around using it in terms of delivering clinical outcomes or helping to diagnose disease states. Also, there's conversations about how artificial intelligence can help with administrative work, which is all great and wonderful. But to us, the sweet spot is really about looking at it from a patient engagement standpoint because of the scalability and ability to kind of personalize those communications to patients and making it culturally relevant. One of the things we saw, trust, especially for patients in underserved communities, is at an all-time low when it comes to institutions. Healthcare is one of those institutions that unfortunately patients just don't trust. And so how do you engage in that trust metric? You have to provide communication channels that reach the patient where they live, not just text messages, not just calls, not just mail, but an omni-channel approach. And artificial intelligence can help with that. So technology is about using connectivity and access, increasing that with more cellular technology and smartphone technology, but also is delivering more efficiencies, be more productive, and personalize it with artificial intelligence. So that's one way technology is helping deliver remote care as a service. The other options we talked about is the operational efficiency. How do you deliver that at scale? Workflows are so very vital for healthcare organizations, right? And the ability to kind of deliver this at scale is difficult, right? Because workflows now work well when the patient arrives into the office where it's an environment that is controlled. You have your front desk office, you have your medical assistants or LPNs that come in and treat the patient in the clinic setting prior to the doctor seeing them. So everything that's done that needs to be done prior, taking the blood pressure, taking the weight, and then a general sense of that. So when the doctor comes in, the patient's teed up for the doctor to deliver the care. And then there's the back office staff to kind of help with the billing. Well, imagine this is flipped on its head where now the environment has to conform to the patient. The patient may be sitting in their car talking to a psychologist. They may be on the road trying to figure out their medication and getting that delivered before they go on vacation. So the environment has to evolve and change. And that's where remote care as a service can deliver that. Having a team that you can outsource a lot of that to can kind of understand how to make those workflows match better is really key. Because think about it, if you have an organization that does this all the time, they have efficiencies, they've built workflows that can change and evolve wherever the patient lives. Just like you as a medical practice owner has already created workflows for your patient populations depending on the traffic that comes in. This is why it's important to outsource and have organizations that understand the logistics of delivering devices to patients wherever they live. The staff, internal staff, to deliver remote care, to reach out to patients and communicate, and the technology that can integrate all this information directly inside your EMR so you have the relevant information and can communicate properly to the patient as you're talking to them in office from all their outside the office conversations. And studies have shown that patients that get more touch points are more compliant, right? And so it's just given to that. One of the things that's helpful for having a remote team organize that, there's a Penn study that shows that proactive medication refills will be able to increase medication compliance by 3 to 6%. So that means patients are being reached out to proactively and say, hey, it's time for your refill. Let's go ahead and start that process. They're going to take their medications more efficiently, more effectively, but more importantly, they're not going to miss medications and have an adverse effect. And so having a remote team to do that is really key and critical in that process. And then finally, you want to look at that financial understanding of how to deliver remote care as a service. Look, it's no secret that a lot of stuff you could potentially do in staff, in office. But we've seen time and time again how healthcare organizations, especially when you look at clinical settings, it's difficult to deliver something like this in the office because you're optimized for a fee-for-service model. Patients come in, they go out. Really works really well when that model was the dominant model. But now with the advent of technology, like we talked about, and the ability to deliver services remotely, now you have to create new models that make sense. For instance, we've seen cases where if you're delivering these services in-house, you're looking at least profitability loss of about 20 to 35%. How does that calculate it? Well, when you look at buying the devices, handling mobile services, handle logistics of that, all the upfront fees for the technology to deliver and operationalize it so it's integrated to your EMR more effectively, the training that goes into understanding how to deliver that type of technology to your staff, and ongoing updates. That's just the upfront piece, right? Now, the ongoing piece, if you're trying to have staff members in-house deliver remote care, it's almost like you have a bifurcated model. You're going to have two staff team members to kind of deliver these services. One is delivering your core services that you deliver in-house with your healthcare organization, and the other team that's just focused on patients that hardly ever come into the office, or they come maybe once a year. So it's two different organizations. And so now this remote team, they may have to work different hours. They may have to have a manager that manages them differently. There's productivity models that you can follow, understanding how many outreaches have happened with that patient population, understanding how often the patient is being communicated with, meeting certain metrics in minutes and hours that you spend with the patient, and ultimately making sure the patient feels connected with constant communication and updates. That's a totally different model than a model where a patient is coming in consistently. So this is something that has to be evolved. So if you're thinking about doing it in-house, think about the cost, not just of having medical assistants, LPNs, nurse practitioners who are delivering this remote care in this environment with the technology and devices, software, services that you need, but also managing that process to make sure they're the most efficient. Then you're looking at an excess of thousands of dollars a month just to deliver the service at a minimum level. Now, if you're trying to improve that, then you got to think about, like, are you creating the right metrics? Are you monitoring metrics? So now you have another layer of management that's doing that, and data analytics to see that. And that can be costly to implement. We've seen cases where it takes practice a minimum of 12 months to even get up to base level to deliver these remote care services for the patient populations. Where, for instance, if you outsource it to an organization, like we've done this with many organizations with my company, SensorMed, we're able to get over 1,000 patients up in roughly 90 days. That means from delivery to onboarding to setup to sending devices to reaching out to communication to setting up billing. And that is a speed that you just can't imagine. That's 4 times the speed, right? Being able to deliver that at scale. And more importantly, it allows you to do what you're trained to do, which is take care of patients at a high level. Not unlike what you do now when the nurse team and everyone's setting up the patient. So when you go into the exam room, having that conversation with the patient is already been taken care of, and all you have to do is focus on their key concern issues so you can solve the problem and provide updates to the patient. And that's what all outsourcing of remote care services is about. Ultimately, when you look at how you're going to deliver remote care as a service at scale and get into this new model of healthcare, we know, number one, that patients want it. Number two, this is the trend of where healthcare is going. This market is accelerating. Telehealth services is growing at a compounding annual rate of 24% and expected to reach 31 billion by 2029, basically almost a 3-fold increase from 13 billion in just 2022. So telehealth services are at the top of the line for a lot of patients and a lot of healthcare organizations. Remote care as a service can help you, number one, deliver the technology that you need, updated, set up, so they can easily communicate to the patient at scale with artificial intelligence and generative AI systems that update automatically and reach out and personalize information to keep patients engaged, but also enabling technology, cellular access, so you get data efficient. Number two, you want to make sure you have the operational set up. With a remote care as a service organization, they can help you do that at scale with the workflows that have optimized to treat thousands of patients as if they were in the office, transforming that patient experience in the home or remotely as if they were in your office, and making sure that's efficient. And number three, the financial costs. Doing it yourself, a lot of capital expenditure up front, and ongoing management fees, ongoing technology services, upgrade technology, and ongoing team staff members. Remember, you're running a separate organization that needs to be efficient for delivering patient care remotely. And so that cost will eat into your profitability about 25 to 30% on a month-over-month basis, as opposed if you outsource that amount out. So again, you think about this, it seems like a no-brainer. Remote care as a service is the path to go. So if you like this video, click below for more information around remote care as a service. But more importantly, go check out some of our other videos about remote patient monitoring, chronic care management, and the other remote care services that you can take advantage of.